everyone, and thanks for taking a minute to watch our video. Today we have a couple of guests with us. This is Dr. Brian Gendelman and Michelle Phillip, a physician's assistant, and they are both at Edgewood Pediatrics. And today they're going to talk with us a little bit about teen health during our COVID-19 crisis, some things that we may be seeing in our kids and ways that we can help them as parents and community members. Brian and Michelle, thank you so much for being with us today. First thing I'd like to know is tell me just a little bit more about yourselves and about your practice.
Okay. Well, my name is Michelle Phillip, and I'm a physician assistant and lactation consultant here at Edgewood Pediatrics. During the last 18 years that I've been here, I've had the privilege to take care of wonderful patients and have enjoyed being a part of a great team. Through this current COVID-19 pandemic, we continue being available to our patients and continue to specialize in newborn through adolescent medicine. We've strengthened our processes to continue to deliver this exceptional care, and our office quickly implemented with the changes virtual visits for many services to add comfort and convenience to our patients. And we've taken extra precautions to keep our families safe, like offering dedicated entrances and exits for varying levels of care, and also providing drive-up services for certain circumstances. As a mother of two boys, aged 12 and 15, I really appreciate everything that we're doing in this difficult time, and I understand the challenges that come with the current environment.
And I've been practicing in this community for 30 years, pediatrics. I've had the pleasure of servicing Commerce Township and the surrounding communities. I've enjoyed the relationships I've made with many of the people in the area. Paramount to my practice is also teaching, and the office has been instrumental in teaching medical students, pediatric residents, family practice residents, nurse practitioner, PA, and medical assistants for the entire 30 years of our existence. I also carry 4 professorships from 4 universities associated with that teaching. I guess what makes me the most comfortable talking to you today or answering some questions is that I'm also a father of 5 children between the ages of 17 and 25. Currently, 4 of them are residing at home and in this new world. And I'm having many, many new experiences, as I'm sure you all are, and I hope I can help answer questions based on my own experiences, both professional and personal.
Thank you so much. I really appreciate your time with Lakes Coalition today, both professionally and personally. It's clear that you care about kids and about keeping kids safe and healthy in our community. Tell me some of the big health concerns that you are seeing right now in your practice, especially with adolescents, teens, young teens, and maybe even young adults.
Okay, so the most obvious being the anxiety and depression. Just with this lack of routine and structure, I think everybody's feeling it to some degree. The decreased exercise with sports being canceled and the closure of gyms and training centers, that's a big problem. Also, they're losing their motivation for schoolwork and activities as this isolation continues with so many unknowns and just more of a need for self-guidance. Also, an issue would be if teens were using vape, drugs, alcohol, they may be experiencing some withdrawal symptoms right now without the access to those items. And then in an effort to gain access to the vape, the drug, the alcohol, they could be sneaking out and potentially exposing themselves to COVID, and also just putting themselves in dangerous and risky situations. And then all of these could lead to increased depression and anxiety. And if there were any underlying comorbidities with any sort of mental illness, ADD, anything like that, obviously it can all spiral into each other with added anxiety and depression.
What are some things that parents should know about teens and substance use right now?
Just remember to be mindful of their behavior as parents. I think they need to remember to keep themselves calm. I think things that they can do would be schedule a family meeting and set reasonable goals and a plan for a routine. Make sure the kids are participating and setting up the plan so that they feel on board. And if necessary, have a third party help them, like a therapist or a counselor, come up with a plan that will work.
I think just understanding that this quarantine has affected all of us in so many different ways. Just stating them, I think, is important. A lack of a school schedule, family closeness, closer than we've ever thought we'd be before, change of routine, a fear of how the virus will hurt us, our families. I think kids are very intuitive, and they know that parents are nervous about the livelihood, financial aspect of this, and the future being unknown. When will school start? Will school start? What's going on with my 17, 18-year-old person who's looking towards college, SAT, ACT? All these things are leading to a lot of stress and anxiety. The other day, we saw a patient in the office who the parents thought had diabetes, a 4-year-old little girl who was urinating more than usual, and the father was very savvy and knew that this could be diabetes. It was not, thank goodness, but it was that the child had regressed. It was now urinating all day long where they had urinated before, and there was no obvious reason other than the stress of the family. Yeah. One of the things that I think is really important is that we as parents need to check ourselves. Our moods and our emotions, we're human beings too, leads us potentially to self-medicate. And remember, we are role models. Yes, we have to take care of ourselves, but we know that alcohol purchases and consumption, marijuana purchase, and therefore we assume consumption is on the increase. We as parents have to remember and be mindful that we're good role models, both good and bad, for our children. And although we are stressed out, perhaps we have to watch what we're doing in front of our children. If you don't mind, I'd like to digress and just talk about marijuana use for a second. It's old and new stuff. Acutely, the thought process is that marijuana isn't going to hurt anybody. I'd like to remind everybody who's listening that our brains are maturing and growing until the age of 25. The young brain in particular is friable or susceptible to toxins, to damage. Whether that's too much video, too much of a good thing they say can hurt, and that's one of those examples. But alcohol and THC, we really don't know what that does to a developing young brain. We know it affects frontal lobe. We know it can cause long-term potential learning disabilities. It can also cause an increase in ER visits and mental illness, increase in schizophrenia. It's really important to be aware. A couple examples. I have one 18-year-old child who thought marijuana use was simple and easy. The first time he used it, he had a seizure. He wound up in a hospital in an ICU and has severe brain damage from it. He's no longer in college. I have another child who's 14 who was vaping for the first time and thought it was no big deal because his friends all did it. And it turned out that he was actually vaping THC instead of nicotine. He says he doesn't know. I'm not sure about that. And he wound up in the emergency room because his behavior was sporadic, erratic, and they thought he was having some sort of a mental breakdown. He was okay, thank God, but the reality was it cost the family thousands of dollars and lots of stress. And again, I know I'm laboring on THC for a second, but there are some older people out there who may be pregnant and use marijuana for escape. And it has been shown, and to de-stress themselves, but it has been shown to decrease birth weight and cause poor development of your baby. And then there's those who are out there breastfeeding, and we know it lasts in breast milk for up to 6 days, and this leads to poor cognitive, which is processing abilities of our brain, and potential ADHD. And just last but not least, just to piggyback off what Michelle said, withdrawal symptoms from THC. We're taught, many people are taught over the years that marijuana is not harmful. But in these isolated quarantine times, people don't have the access that they used to have. And we're finding kids are having withdrawal symptoms who were chronic marijuana users. And those symptoms can be severe headaches, vomiting, and acting stuporous, almost like they have meningitis. I've sent 4 or 5 children to the hospital over the course of the last year, worried that they had brain tumors or meningitis, only to find out they were withdrawing from THC. A helpful tip from a father of 5, I do take a magic marker and mark the alcohol bottle as to where it was. Of course, my sons picked up on that and quickly said, "Dad, what if we just added water to it?" So that idea went out the window, and now I have to make sure it's locked up somewhere. I'll leave you with that answer.
Thank you so much. There is just a lot on kids' plates and a lot on parents' plates. And parents are struggling at this time as well. You've already touched on many elements, but are there any other really positive things that parents can do to help their teens cope in healthy ways? What are some healthy strategies that you would recommend for kids or for parents?
Absolutely. And that kind of goes back to just making sure that they schedule that family meeting, set the reasonable goals and routine, get a plan with the kids involved so that they feel on board. And in that routine, set up a wake and sleep schedule. Take advantage of the later school start times, but make sure your teen is getting the 8 to 10 hours of sleep that they need at night. Regular exercise is important, even if it's simply going for a walk, finding an exercise app. Homework, set up a time and location so that we know that gets done and the expectations are clear. Get outdoors. We all know being outdoors is beneficial to everyone, being in nature. Good nutrition is important to make sure that you're feeling better, and it's an opportunity to share meals and encourage open discussion as to how everyone is coping and handling things. Remember your mental health and just practice the social isolation, but make sure you reach out to your friends and keep connected. And then take it as an opportunity. Virtually, exactly. Stay connected virtually. And then lastly, just have fun. Take it as an opportunity to try something new that maybe you haven't had the time to do. Maybe try a new instrument, painting, do projects together and alone. And then actually just today, there was a write-up with the AAP, a quote from Dr. Catherine Williamson. And she said, for today's teens, quote, "Even if everybody at home gets along, it is really important for their emotional development to have their own downtime." So I think that that's just really important to keep in mind.
And then from a medical standpoint, remember, you've spent years forging a relationship with your local doctor, be it a pediatrician, a family doctor, a PA, a nurse practitioner. Most of us are available and willing, able to have conversations, be it virtually or in a safe time in the office. I think it's really important to remember that we have experience in talking to people, counseling them through situations, offering perhaps a psychologist or social worker on a professional basis who's doing virtual visits. Some people even discuss medications. I've started several people on some antidepressants recently. Remember the relationships we built over the years, and we're still here to help. And don't ignore that relationship that's been built over the years. And just to end with, every visit we've had at Edgewood, and there haven't been many in the office, mostly are virtual, are fraught with a conversation about this topic. So whether you think it's silly to talk about, you think it's only you, it's absolutely everybody. Everybody from the father, the grandfather, the mother, the 3-year-old child who's having trouble wetting the bed, to the teenager who's struggling with college, the future. We're all dealing with this situation. And the more we talk about it, safely and honestly, the better we'll all be.
Thank you both so much for your time today. Honestly, as a mom of 4 teenagers, I really feel better just having listened to what you've said today, because everything you've said are things that I am dealing with as a person and as a parent, and that I'm seeing in my kids. And it's hard. It's hard to stick to the routines. It's hard to motivate our kids to stick to those routines. But we have to, for our own mental health and for the health of our kids. I'm so grateful for your time and your willingness to work with our coalition, and for your taking part in building a healthy, vibrant, drug-free community. Thanks so much. We appreciate you. We appreciate your practice, and we hope to talk with you again soon. Thanks.
Thank you.
Stay safe.